Welcome to Fit and Bold, where we promote healthy lifestyles. I'm your host, Lakita Goins. According to the Centers for Disease Control, 50 million Americans had arthritis in 2009. That number has increased since that time. Today, Dr. Bird is here to help us get a better understanding of what arthritis is and how it can be treated. And you're here from the UAMS Area Health Education Center.
Yes.
How are you today, doctor?
I'm doing all right, thank you.
Okay, I always start with the same question. What is? So what is arthritis?
Well, arthritis essentially is a deformity within specific joints within the body. That could be within the hand, the wrists, knees, hips, and the back that diminish a patient's ability to pretty much do activities of daily living.
Okay, are there different types of arthritis?
There are. The main ones that we usually deal with would be osteoarthritis, then there's also rheumatoid arthritis, and there's several different other types or subsets of those arthritis or types of arthritis. You can have infections that can cause arthritis, or autoimmune diseases that can also do the same thing.
Okay, so and you just said this, but can you just talk about the most common types?
The most common type that we usually deal with is the osteoarthritis, and usually that is caused by wear and tear, age. It's the main component that causes osteoarthritis would be weight.
Okay.
Because increased weight puts more pressure on especially knee and hip joints, which can decrease the joint space, which causes bone-on-bone rubbing, which causes the actual pain and inflammation.
Okay, so are there any other risk factors for developing arthritis?
Studies have shown that arthritis occurs more in women. It does also occur more commonly in older age once you've had time in order to wear down those joints.
Okay, that makes plenty of sense. How do doctors know if a person has arthritis?
Usually the complaints that they come in with, the joint stiffness, trouble with activities of daily living, warmth in the joints or swelling in the joints.
Okay.
Would be the main symptoms that most patients complain about.
Okay, are there tests that are done?
Initially we do just a basic history and physical exam.
Okay.
We look for a decrease in the range of motion secondary to pain. After that, we will get x-rays of the joints. We can see narrowing of the joint space with osteoarthritis or rheumatoid arthritis. And then depending on if there's joint swelling or if we need further testing, we might actually aspirate a little bit of fluid from the joint in order to send it to the lab for testing, which can kind of help us differentiate between lesser known types of arthritis.
Okay, so what's rheumatoid arthritis?
Rheumatoid arthritis is an autoimmune attack to the joint space, as opposed to osteoarthritis, which is kind of a wear and tear.
Okay.
It usually does occur in older age as well, and also is more common in women. Difference, I guess, in between osteoarthritis and rheumatoid arthritis would be that rheumatoid tends to affect bilateral joints, like both of your knees will hurt or both of your wrists will hurt,
Okay.
As opposed to osteoarthritis, where it might just be one or the other.
Okay. If a person has arthritis, what factors can affect it? Does the weather affect it? What type of shoes you wear? What affects it?
Well, depending on if you're dealing with osteoarthritis, rheumatoid arthritis, some of those might be a little different. Changes in the bariatric pressure or what actually cause osteoarthritis patients to complain, like, oh, I can feel rain coming on, because the changes in the pressure causes different pressures on the joints, which that's what they're essentially feeling.
Okay.
Different types of shoes, can affect the types of arthritis, just because of the type of support that the shoe might provide and whatnot.
Okay. Can you talk about life with arthritis, the treatment options? What can make it better?
Okay. The main thing that we recommend for these patients is to stay active. Especially for the overweight patients, one of the things that we like to recommend is exercises that are light on the joints. That would be water training, water aerobics. There's not a lot of options here in town necessarily, but that's one of the best things to do.
I'm
for
glad
that
you
treatment.
said that,
Yeah.
because Black and Gold Fit and Bold has, I believe it's like 8 water aerobics classes a week.
Oh, really?
Mm-hmm.
Yeah, so that'd be great, because we just we try to find options for our patients, and that's one of the number one best things to do, especially for our overweight patients or patients with a severe disease.
So now you can tell the patients, as a matter of fact, Monday, Wednesdays, and Fridays, 5:30 to 6:30, 6:30 to 7:30 at the
Okay.
Hyper Complex.
Okay.
And they have a class on Tuesday and Thursday as well.
Well, there you taught me something here today.
Okay. Can what you eat affect arthritis?
There have been some studies that show that certain diets can affect rheumatoid arthritis in particular.
Okay.
Well, for the most part, we usually don't necessarily recommend any specific diets
Right.
for rheumatoid arthritis, but diet in general, especially with osteoarthritis, to cut down on weight will definitely help out with that.
Okay. So is there anything else that you want to say to our audience about arthritis and going for treatment? Does it matter, like, if you feel like you've been having these pressures and these pains, if you just wait? What happens if you just wait and you don't go to the doctor?
Rheumatoid arthritis, it can be pretty serious if you wait around, because there are therapies that can slow the progression. Won't necessarily stop or cure rheumatoid arthritis, but you can slow the progression to where you can have several more quality years. With osteoarthritis, just diet, exercise are one of the mainstays that we try to enforce with those patients, and just stay active.
Right.
And don't suffer in silence. If you think something's going on, just come out to your primary care provider, let them know what's going on, and see if there are some therapies that we might be able to provide for you so we can improve your quality of life.
Okay, so that made me think, are there any oral medications that people with arthritis have to take sometimes?
For osteoarthritis, there's not any actual scheduled medications that they can take, but NSAIDs usually help out a lot because it's the anti-inflammatory medication that can reduce some of the inflammation within the joint that helps out with the symptoms. But with rheumatoid arthritis, we use NSAIDs as well, but then we also use anti-rheumatic drugs like methotrexate, hydrochloroquinolone, sorry.
Okay.
And those medications used on a regular basis are the ones that will actually stop the progression of the disease and help you to have more days that you feel better.
And I know these are all extra questions, but earlier you mentioned some lesser known forms of arthritis.
Right.
Can you talk about that a little bit?
Yeah, sure. Some of them are non-inflammatory, others are inflammatory. Usually they're differentiated with aspiration of the joint for the most part, or the history and physical. Those include gout, can affect the great toe, and then also the knees are one of the main areas that gout affect. Lupus has a form of arthritis that's inflammatory, and then also infectious arthritis, usually associated with like a gonorrhea, sexually transmitted disease. You can actually have an arthritis that'll affect one or the other joints.
Wow.
That usually goes away after we treat with the appropriate medications.
Okay. So I learned some new things just now. Thank you, Dr. Bird, for talking with us today about arthritis. Audience, I want you to stay tuned, because when we come back, we're going to be doing our Fit and Bold Healthy Recipe Pick.
At the University of Arkansas at Pine Bluff,
I'm part of a place where I'm always challenged to do more.
I am a part of a place where I can be involved.
I'm a part of a place where everything is possible.
I'm part of a place where champions are made.
At the University of Arkansas at Pine Bluff, you can get an affordable education with competitive degree offerings, diverse student population, and stellar faculty. Become part of a place where you can get everything you need to succeed. Become a part of the pride at the University of Arkansas at Pine Bluff.
Jack Frost, You do have beautiful teeth.
My what?
Are they really as white as they say? Yes! Oh, they really do sparkle like freshly fallen snow. This is an excellent example of what teeth should look like. Check out the iridescence of that incisor, the beauty of that bicuspid, the magnificence of those molars. And the best way to achieve such terrific teeth is brushing. 2 minutes, twice a day. Not 30 seconds, not a minute 45. 2 minutes. That's all it takes. They're beautiful.
Maybe he's really focused.
Hey, Michael. Michael. Maybe he likes spinning the wheels.
Maybe he just loves trucks.
Maybe he's just being a boy.
Preoccupation with objects is one early sign of autism. Learn the others today. The sooner it's diagnosed, the better.
A full life, measured in seats, starts with the right ones early on. Car crashes are a leading killer of children 1 to 13. Learn how to prevent deaths and injuries by using the right car seat for your child's age and size.
Welcome back to Fit and Bold. Today we've been learning about arthritis. So today's Fit and Bold healthy recipe is grilled peaches. So it's still warm outside. You can still fire up the grill, but this will help with the sweet tooth and the arthritis. So when you go to the grocery store, your shopping list includes peaches, cinnamon, vinegar, and honey. And that is a very short shopping list. So the first thing you want to do is, I'm using a George Foreman grill because I'm not outside, but I'm going to go ahead and turn it on so it can heat up. Then I have my peach. I'm going to cut it, and I'm going to do it into a couple of smaller pieces. And you want to try to find a ripe peach that's naturally sweet. The peaches are good because they have lots of vitamin C, and vitamin C is good for arthritis. Now, what I'm going to do next is prepare my peach marinade. So that consists of taking the vinegar, and you just want to put enough to have a light coating on the bottom of the preparation plate, and enough for all the peaches to soak in. You're gonna then put the honey, and this will add extra sweetness to it without using sugar, because if you have arthritis, you want to try to avoid having a sugary diet. And then we're going to mix cinnamon. Now, although there's not firm scientific research on this, it is said that when you mix cinnamon and honey, it has anti-inflammatory properties that really help a lot with arthritis. So then I'm just going to kind of take a spoon and mix this up a little. Then I'm going to slice my peaches a little thinner so that they can lay flat in this marinade. And this is really quick and can function as a dessert. Some other foods that are said to be good if you have arthritis. The drink green tea is supposed to be good for you. Omega-3, which is found in fatty fish. Anything that has anti-inflammatory properties will help with the inflammation in your arthritis. It cannot cure arthritis, but it can help you. And so I'm letting these soak, and I'm gonna flip them over so that both sides can be in the marinade. Ideally, you would like these to sit for about 5 minutes. Once the peach is sliced, it's really porous, so it'll absorb it really well. Okay, now there are also other spices that can help with arthritis. Ginger, turmeric, those type of spices you may want to look for in your grocery store, or you may want to Google them to see what different ways you can use them and incorporate them into further recipes. But they all have anti-inflammatory properties, and in some cases, like honey, for example, they have antibacterial properties as well. Cinnamon also increases brain function. The smell of cinnamon can even boost brain activity. Okay, so the next step, very simple. These are ready. You want to go ahead and place these on the grill. And on this indoor grill, electric, you would only need these to cook for a few minutes. You can let it cook open-ended, which is what I'm going to do here, and it'll only take 3 or 4 minutes. Now, on the outdoor grill, it may take longer, and I will also suggest wrapping the peaches into aluminum foil. This way, when they're outdoors, it does not drain the natural juices from it. You can contain those within the foil wrapping, and you can even seal the foil to let it get the smoke flavor without having the fire. Okay, and I'm going to just flip these, and they're sliding a little. This is also a dessert that the kids can love. You can fool them into eating healthier without them knowing it. So for now, I'm going to close this just for a few seconds. Also, in addition to eating healthy, it's important to note that for arthritic patients, it's important to stay active. Now, you always want to consult with your physician before deciding on what level of activity is right for you, but if you keep moving, it improves your overall health and it can help out with your arthritis. Also, don't forget to always consult with your nutritionist or physician before trying any new recipes or before starting to set your new diet. Okay, I'm ready to open these back up, and you will see that they are browning and they are ready. So I am going to start pulling them off, and they're very warm, so I'll be careful. And that is your dessert, and if you try this at home, you'll smell the flavor. The smell is just really good. It makes you want to try to taste it and try something new. And I know a lot of people don't like to grill their fruits, but grilled fruits and vegetables have a really good taste. You can also try pineapples, apples, any other fruit you can think of, because bottom line is, if you have arthritis or many other health conditions, including heart conditions, eating those bright fruits and vegetables will be good for you overall. So I'm going to just grab one and I'm going to taste it. And that is really good. The vinegar gives it just a slight tang taste to mix with the sweet, and the honey adds to the sweetness. So overall, it's a great, robust flavor. So when we return, we're going to be exercising. So go from your grill, get your exercise gear, and stay tuned.
Are you getting this, honey?
Oh, prime time. We are rolling.
All right, Mama's gonna bring it home. Mom's gonna bring it home.
Okay. Come on, watch this guy.
Oh, backwards!
Oh, don't. Okay.
It went into Bob and Carol's yard. Oh, no? Okay, here it comes.
Oh, no!
Challenge your kids to be active and eat healthy.
All right, let's see what you can do. Let's go.
They might surprise you. Search We Can for more ideas on how you and your kids can get healthy together.
There are a million places you'd never consider texting. So why would you do it while driving? Leave risky driving to the professionals. Stop the texts, and together we can stop the wrecks.
Body language can tell you all sorts of things. Like someone is having a stroke. Know the sudden signs. Learn fast. Face drooping, arm weakness, speech difficulty. Time to call 911 and get them to a hospital immediately. Learn the body language and spot a stroke fast.
I'm Bluff with a degree in Regulatory Science, Industrial Health and Safety. I thought I'd be looking for a job right now, but with the help of my mentor, Alicia Farmer, and Career Services, I was able to land a position as a seed quality supervisor after training.
As a single mother, Latasha's motivation and determination helped her to earn 2 internships while on campus. UAPB can help prepare students like Latasha for the same opportunities.
UAPB prepared me.
Welcome back to Fit and Bold. Today we've been learning about arthritis. So I'm here today at Anderson's Taekwondo in Pines Mall, and I have a special guest with me. Please tell us who you are.
Hi, my name is Freddie Wright, instructor here at Anderson's Taekwondo.
Okay, and tell us a little bit about the program and what we're going to be doing today.
Well, today, with the focus being on arthritis, I'd like to tell you guys we practice a Korean form of martial arts known as Sungun Taekwondo. It encompasses a variation of moves, stretches, and strikes that help with joint pain, muscle pain, and stress on the body.
All right, it sounds great, audience. So let's get ready to exercise. was wonderful watching the people work out here at Anderson's Taekwondo. So remember, if you have any comments, questions, if you would like to be featured on the workout segment or recipe, if you're a doctor, just email fitandbold@uapb.edu. Remember, getting healthy is a lifestyle journey. You have to start somewhere. So the best thing to do is get fit and be bold.